We arrived here at the University of Maryland in 2010 to launch a brand new Center for Health Equity. And one of the first things that we had to do was think about our strategic plan. And it's not uncommon for people to go off campus and find consultants. There are organizations that make their living that way around this town. And then I heard of something called CLOC. And what impressed me was that, number one, it was on campus, that they knew the value and the culture here at the University of Maryland and what it meant to be a Terp. My team, and there are 5 of us, was convinced that the folks at CLOC really did understand what our needs were. One of the things that we were able to accomplish that may not have happened were it not for CLOC was the recognition that the University of Maryland is a big place. I don't think we knew what it meant to be part of the culture here, and then to make sure that our vision was consistent with those values. Now, we found that they overlap quite nicely. From the time that we came in 2010, within the first year, top leadership that brought us here changed. A new president came on board, a new provost came on board, a new vice president for research came on board, and the work that we had done with CLOC really enabled us in a very succinct way to tell our story to the new leaders. It wasn't as if they had a preconceived idea of what a strategic plan is and just imposed it on us. It actually evolved from a very sophisticated process that the team at CLOC put in place. Yes, it took our time, but it also actually cost real money. And I would say it wasn't cheap. And part of the message there is that I think we got what we paid for, and more so. What was most important was that the CLOC infrastructure is on our own campus. And so while we could have gotten a cheaper strategic planning process, I do not believe that we could have gotten a priceless one. And that's what I believe CLOC delivered for us. It's worth it.